Bismillahirrahmanirrahim. Assalamu alaikum. Thank you, Dr. Farooq. So since we have some international speakers, so I will speak in English. And Dr. Farooq, how much time do you have? 1 hour? 10 minutes. Okay, 10 minutes. So this is a conference which we started last year. And the journey obviously is new. This is not like telemedicine or other areas which we have been working for decades. This is a realization which we all have had in the last some years. And the basic premise is that we have to create health because we live in a sick care system and we need to move to that. So that's why I did some research in the last 4 or 5 years. As a physician, so I'm not wearing my digital health or patient safety hat or research hat or training hat. I'm wearing my lifestyle or a patient hat. So I'll start with this definition so we all know what health means. And this slide tells us that we are not living in a health system. And health has a very deeper understanding and meaning than what we probably understand. So a healthy man wants 1,000 things. A sick man only wants one. When we get sick, nothing matters in the world. And when we are healthy or relatively healthy, everything matters other than health. So that's the reality, unfortunately. This is the model which I have created after around 5 years of research and following the gurus in this field of lifestyle medicine, functional medicine, integrative medicine. And I've created this model which stands on 4 pillars. And these 4 pillars actually create health. And the first, and I'm going to talk about all 4, inshallah, in the limited time which I have. And I will give you some evidence as well, inshallah. So this is sick care system. And I was so happy that the minister also mentioned that we live in a sick care system, and this is the definition of a sick care system given by a physician who runs a hospital, right? So, and you can see the comparison between what is sick care and what is health care. And you can clearly see that a sick care system is essentially a reactive system. We react when something happens, as opposed to a healthcare system which is proactive. We need to intervene before things happen. Okay, so we talk about the metabolic disease or the problem which we have. These are most of the metabolic diseases. And unfortunately, this list tells us that in the last 40 years, all of these diseases have gone up, and none of the diseases, not only that they've not been eradicated, they're not reduced. Every disease has gone up, every. It means that we are doing something significantly wrong. In the last 30, 40 years, we have done something significantly wrong. We, all of us. So we have physicians, we have nutritionists, and we have regulators, we have all stakeholders. We have a psychiatrist, the leading psychiatrist of Pakistan. So these slides I will not burden because my time is limited now. So we all know the numbers, right? The numbers are staggering. And they're increasing every year. Pakistan has now become the #1 country in the world where diabetes is growing the fastest. There must be a reason behind it. So I'll just move forward with these. Now, what is health? This is the critical slide which I want to talk about. So health, we think that having a blood sugar, normal blood sugar is health. That is not health. Health is basically metabolic health. So we have to actually go to the core and understand. And what is metabolic health? Metabolic health is metabolic health, as I call it. And what do you mean by metabolic health? If your mitochondria is healthy, only then you are healthy. And Ahmed Saab mentioned that muscles are important. Why do you think muscles are important? Mitochondria, the largest number of mitochondria reside in the muscle. Muscle is the biggest reservoir of mitochondria. In addition to giving, your posture, obviously the strength and everything, but the more muscle you have, the more mitochondria you have. The more mitochondria you have, the better health you have, period. Simple equation. If you want to be healthy, make your mitochondria healthy. To have mitochondria, you need two things. You have to have more mitochondria and you have to have a healthy mitochondria. And I'll talk about that. So this is basically our premise, that we need to focus on the mitochondria rather than some tests. If I have my blood sugar is okay, it doesn't mean anything. So healthy mitochondria is our goal. So these are the terms which the world is using. Without going into the jargon of the term, you can use lifestyle, you can use functional, integrative medicine, but all these three overlap and they talk about healthcare. So the model, as I said, stands on 4 verticals or 4 pillars. So let's talk about the first, which comes last, but since it's the most important, food for health. And Dr. Nausheen and others are also going, she spoke about that already. So this is where we stand. Now just imagine a young school-going child in the US, when he or she goes to the school, he or she has already consumed her daily requirement of sugar in the breakfast she gets or he gets in the school. So if you have taken a soft drink, you actually consume more sugar already, other than all the different sugars. So please keep that in mind. And why do we talk about sugar so much? Because if you ask, Nausheen or other nutritionists or other people, which is the number one culprit in this equation? Carbohydrates/sugar, refined carbohydrates. And why? Not because it increases our blood sugar level. Again, please change your paradigm. Because sugar affects what? Mitochondria. That is why it is a culprit. Not only because the levels go up and down. Once it hits your mitochondria, it creates a havoc in your body. And all of the chronic diseases, all have a basis in sugar and insulin. Insulin resistance is the one factor which is behind all of the chronic diseases. And just ask the physicians. And I was so happy when Dr. Farooq said that I do test. Fasting insulin, kitne physicians karte hain? They don't. No one tests fasting insulin. Everyone tests what? Fasting blood sugar, which is obviously important. But the most important thing is fasting insulin, because insulin, if you have, and by the way, you can have insulin resistance with normal sugar levels in blood as well. So it means that you are missing the real problem. So we move forward. So is it only about calories? No, it's not about calories. It's about composition. So if you restrict your calorie intake to, let's say 1500, right? You'll be very, very happy, right? You'll be proud of yourself. But you can fill that 1500 calories with maybe 5 donuts. So is that good? No. So the composition is actually more important than the calorie problem. Calorie is not the major problem. The composition, what you eat, that's important. So we need to remove E from our lifestyle. And this is such an important evidence-based. So everything I'm showing you is medically published in our journals. We have evidence published in our literature, and the research is done by physicians themselves. And this is how we remove E from our lifestyle. So rather than feasting all the time, we need to be fasting all the time. And intermittent fasting has been proved again in our literature, again and again and again, intermittent fasting. And what is intermittent fasting?
18 hours of prayer.
So if you can keep yourself away from food for 14 hours, starting from 12, depending on a lot of factors, you can drink tea without sugar and milk. You can have coffee, but yeah, okay. So again, so Robert Lustig is one of those people who I follow and I admire. So look at what he says. Protect your liver, feed your gut. These are the only two things we need to do. And how do you protect your liver? From sugar. How do you feed your gut? With fiber. Sugar, fiber, fructose and fiber. So is drinking apple juice as good as eating? Obviously not. Because although the calories are the same, but it doesn't have fiber, right? And we're getting the calories immediately. So non-alcoholic fatty liver disease, Dr. Farooq will tell us, 40 years ago, it was rare. Today, around 40% of American population has non-alcoholic fatty liver disease only because of fructose and what we eat. So I'll skip this, Pakistan maybe. I'll skip this because it's a very heavy and a very complicated slide, and I don't have time. But we look at fat people, that they are the problems only. Actually, the thin, sick people is a bigger problem than the fat people. And that's the statistics, and we can talk about that. So genes are not destiny. Yes, genes are influential, but they're not destiny. The destiny is influenced by what we eat. So cancer, 75% of cancer is preventable. I'll move forward because I have to cover the other 2, 3. So food as medicine. You know, visionary people, even if you don't have to be a physician to figure this out, right? And that's what Edison said to all of us. And our own physician, this is Shafi. So you know who this guy is, right? He is the ultimate guy, William Osler. You know, our friend knows that. What did he say? Look at the last thing he said. One of the first duties of physician is to educate the masses not to take medicines. So what do we do? Right? So we look at our second, sleep for health. Sleep well, live well. So just quickly covering it, there are 3 aspects of sleep. One is duration. So you see a lot of evidence here. How much? 7 to 8 hours, right? Second, quality, and third, timing. So it's not enough to sleep 7 to 8 hours. If you're sleeping, starting to sleep at 8 a.m., you need to have the timing has to be right and the quality of sleep. So you need to sleep in a dark room, not take coffee or tea just before, even if it doesn't affect you. But it is affecting you at the metabolic level, or the physiology is affected. So I'll skip the sleep now, and I'll move to the third pillar. All of that evidence is there. Then the lifestyle. So my friend, Amar was asking me, what is the lifestyle aspect? Because sometimes we call all of this lifestyle. But in my model, this is actually a vertical. And I'll show you what it means. It means that there are 3 subcomponents of lifestyle. One is the behavior. And again, as I said, there is evidence that when you have good relationships in your life, when you have friends, when you show altruism, and when you are grateful in your life, you are healthier. Think about it. When you have relationships, that comes under behavior. The second is your environment, right? And I'll skip all those studies. Second is the environment. If you are working in a coal mine, obviously, you will be unhealthy. But the third is toxins, how you expose yourself. And the biggest toxin which we are consuming, anyone? Microplastics, the biggest toxin for everyone, and for our ladies, the makeup, the lipstick, all of that which we use. So that's the toxin which we are exposing ourselves, right? Then exercise. I think I don't need to cover that. Amar has done a brilliant job, and I'll leave a little bit for Shafi as well, because he's going to talk about longevity. But I'm going to talk about a little bit of what are the 2 components of exercise. So just a few minutes, inshallah, and then I'll close. So there are 2 aspects. One is that we need to oxygenate ourselves, right? So brisk walking, yoga, all those things, that is important. And some of the studies have shown us that exercise is perhaps the single most, intervention, single most, which can create health. So why do you think we are having Alzheimer's? 2 reasons. First is sugar or ultra-processed food. So, we say that if there's something, whatever you're eating, so in the US, 75% of the food in your stores is ultra processed. So anything which comes in a box has a label on it, right? Is pretty much ultra processed, not processed, ultra processed, and sugar or carbohydrates, mostly fructose, not taking fiber. So that's one cause. Because you know what Alzheimer's is called? What is the other name of Alzheimer's? Oh. Alzheimer's is part of dementia, but Alzheimer's is also called type 3 diabetes. Thank you. Think about it. Alzheimer's is called type 3 diabetes, right? Think about it. So we have evidence that if you walk 30 to 40 minutes a week regularly, and you know what Amber's team did, and if you are avoiding sugar, you will be, even you can actually stop dementia at the early stage, because dementia and Alzheimer's sets in around 15-20 years ago. If it exhibits today, it started 20 years ago. So you can stop it even if you have the genes. So I'll just see what else I can talk about before I close. Yeah, so exercise and stress. So just to close our comments, as I said, there are 4 pillars of health. Mitochondria is the key. How do we keep the mitochondria healthy? By avoiding carbohydrates and sugar. Just thought of something. So there are 3 kinds of foods, right? Carbohydrates, proteins, and fats. ऐसे ही है? इनमें से essential कौन से हैं? इनमें से 2 essential हैं. कौन से हैं? Not carbohydrates, proteins and fats. इसका क्या मतलब है? We have to take proteins and fats in our diet. If we don't, we will not get enough. Interestingly, carbohydrates is not essential. Even if we don't take carbohydrates, our body will produce that. Second question, इन तीनों में से जो है कौन सा है जिसकी आपको जो है वो क्या कहते हैं ड्रग्स की जो नहीं क्रेविंग नहीं वो जो एडिक्शन, आई एम सॉरी, या दैट्स द वर्ड आई वाज लुकिंग फॉर. इन 3 में से किसकी एडिक्शन है? प्रोटीन्स, फैट्स, कार्बोहाइड्रेट्स? कार्बोहाइड्रेट्स. So you are addicted to carbohydrates and you don't need them for your health. So just think about it. And you are consuming carbohydrates the most, and not just carbohydrates, ultra processed, carbohydrates and food and processed. So I think the message which I would now close with, please change your paradigm from just having a blood sugar level. That is really not the main thing. Go down, build your muscle through exercise, not only to show off, but to have more mitochondria. The more mitochondria you have, the healthier you are, inshallah. Assalamu alaikum.